Hello everyone. Today we are going to discuss about cancer with sun science. We have with us Dr. Ajmal Sherif, medical oncologist at American Oncology Institute, BMH, Calicut. Welcome, doctor.
Thank you.
Doctor, is cancer a death sentence?
Absolutely not. Basically, when a patient is diagnosed with cancer, there are a lot of investigation which you have to do. It includes staging evaluation. So the prognosis depends on the stage of illness, about how aggressive the disease is, and how it responds to treatment. More than 60 to 70% of cancers are curable. So it is essentially not a death sentence.
Does mobile phone usages can cause cancer?
No, mobile phone usage does not cause cancer. The main reason is the mobile phones emit non-ionizing radiation. So when you compare with X-ray, CT scans, they have ionizing radiation. And mobile phones also emit a very, very low dose of non-ionizing. Non-ionizing radiation does not cause cancer. But if it is ionizing radiation, that is when you have a CT scan, X-rays, when you go beyond the limit, so the patient undergoes more than 10 to 12 CT scans per year, then there is a slight increased incidence of cancer.
Doctor, does sugar and artificial sweetness can cause cancer?
Okay. So there is no evidence that sugar causes cancer. But at the same time, if you consume a lot of sugar, you can have obesity. So obesity is a risk factor for cancer. In other words, if you use artificial sweeteners, like you have this sugar, brown sugar, what we call as, or some other modified type of sugar, it does not increase the risk chance of cancer. And at the same time, obese patients who take more of sugar, if they have predisposing illness like diabetes, etc. So diabetes can be a risk factor of cancer. In those patients, they definitely have to control their sugar intake. Otherwise, there is no obvious evidence that sugar causes cancer. Excess sugar causes cancer.
Okay. Well, cancer can spread through biopsy or any kind of surgery.
No, actually it does not spread because of you undergo a biopsy or surgery. Okay. However, you can divide into two different types of biopsy or surgery. So in case, I will just give an example of an ovarian cyst. Okay. So if the ovarian cyst is harboring tumor, if in that case the tumor has not spread anywhere else in the body and you go for a biopsy, if the capsule gets ruptured and it spills into the abdomen, then there's a chance that it can spread. In otherwise condition, what you do is when you go for a surgery, you remove the entire thing with the capsule intact. In that case, you don't go for, there's no chance of increasing spread of cancer. The same time, you have this renal tumors, kidney tumors. Those patients, we advise them not to go for biopsy because they usually have a localized tumor in the kidneys. So if you puncture that wound, there is a chance that it can seed to the neighboring tissues. In those cases also, you have to go for a surgery. So a detailed evaluation prior to biopsy and surgery is mandatory so as to reduce the chance of spreading.
Doctor, does cancer always come back?
Okay, cancer coming back is called as recurrence or relapse. Okay, so it depends on a lot of factors. The main factor is the tumor histology. Okay, that is the type of tumor, its grade of tumor, stage of tumor, the age of the patient. So there are multiple factors which determine the type of recurrence. There is something called early recurrence, there is something called late recurrence. So there are multiple types of recurrences. Okay, so it's not necessary that all the cancer will have to come back. So when a patient has aggressive cancer, like if you say a stage 3 ovarian cancer, serous type, even after treatment there is 70 to 80% of disease might come back. But if you compare it to some breast cancer, if the patient has a stage 3 breast cancer post-treatment, the chance of recurrence only 15-20%. That means 80% is cured. So these are the factors which decide the type of recurrence and when it will recur or not.
Okay. Doctor, what are the latest developments in cancer treatment?
Okay, so when you in medical oncology till the year 2000, okay, we only had systemic chemotherapy. Basically, we give IV medications, intravenous medications. Okay. Now, depending on the tumor biology, we can target the genetic defect which causes cancer. That was targeted therapy. Okay. So what you do is once the biopsy is taken, that tissue is sent for gene sequencing and you get a target, the mutation which is responsible for cancer, and you have a list of medications which can block the defect. Okay. So that was target therapy. And now the last 5 to 6 years, we have something called immunotherapy. Those are medications which can boost our immunity and kill the cancer cells. Okay. So right now we have a lot of cancers like melanoma, lung cancer, renal cancer, in which immunotherapy has made a pivotal change. Okay. the entire landscape of treatment is being changed because of the newer treatment options. So furthermore, we are already, the research is still ongoing about whether we can completely avoid systemic chemotherapy. So these studies are being on, and also we are also trying to somehow cure stage 4 cancers. So these are all, the future predictions. So we just have to wait and observe. Thank you.
Hope everyone understood about the controversies in cancer treatment and also various treatment for cancer. Thank you, doctor. Thank you for your valuable time.
Thank you.